Most people, when they think of rheumatoid arthritis, they just think of this as a disease of old people. But the early signs of rheumatoid arthritis often start in your 20s or 30s, and they don't always start with just the joint pain. Today, I am breaking down the 5 early symptoms of rheumatoid arthritis. You may probably haven't heard of those. And these are the hidden signs that could save your joints from permanent joint damage if you catch early and now. Hi, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Rheum Doc, as well as a practicing rheumatologist here at Empowered Arthritis and Rheumatology Center. Today, I'm trying to make the symptoms of rheumatoid arthritis simple. So I'll be telling you 5 most important symptoms of rheumatoid arthritis. Before I go further, don't forget to like and subscribe to our channel so that you can get update on the new videos that we are creating. Also, please comment on the comment below on what type of rheumatoid arthritis content you want to hear from us. Also, accept our gifts. We have created 2 gifts for you. One is a free recipe of a smoothie, anti-inflammatory smoothie that you can prepare every morning to fight against the inflammation of rheumatoid arthritis, as well as a free copy of our book, the Holistic Rheumatoid Arthritis Guidebook, that is written to help you understand more about rheumatoid arthritis. As many of you are aware, rheumatoid arthritis is an autoimmune condition where your body attacks your own joints. And it is caused by inflammation in the joint lining. We call that synovium. And it is not due to wear and tear of the joints. So early detection is the most critical factor in preventing long-term joint damage due to rheumatoid arthritis. Sometimes the symptoms are so subtle that you may not appreciate the symptoms of early rheumatoid arthritis. But the time is critical in rheumatoid arthritis. If we can recognize the symptoms and signs of rheumatoid arthritis early, your long-term outcome becomes better. There's less risk of joint damage. That's why it's very critical for you to understand the early symptom and signs of rheumatoid arthritis. Now, the number 1 symptom of rheumatoid arthritis is persistent joint pain and swelling. And often, the symptoms of rheumatoid arthritis start in your small joints, particularly your knuckle, your fingers, and the wrist joints. It can also affect your toe joints too, where you could get foot pain. When you feel your joints, you can feel the tenderness in those areas. Normally, when you feel your joint, it feels very bony. But if you feel soft swelling around your joints, which we call boggy feeling in those knuckles, that could mean inflammation in your joints, which is an early sign of rheumatoid arthritis. And the pain of rheumatoid arthritis is persistent. It does not go away with rest. And interesting enough, it could get worse with rest. And the reason you have those symptoms of swelling and pain is due to inflammation in those joints. And in medical term, we call that synovitis, which is basically a build-up of inflammation and fluid in your joints. And the inflamed joint lining create more fluid, causing significant joint pain and swelling in your joint area. So just remember, if you have this persistent joint swelling or joint pain that is not well explained, then it could be an early sign of rheumatoid arthritis. The number 2 symptom is morning stiffness. In particular, if the stiffness lasts for more than 30 minutes. When you wake up in the morning, you might feel some mild stiffness, which could be normal. But if your symptom of stiffness is severe and lasts for a long period of time, it could be an early sign of RA. And when you wake up in the morning or when you are inactive, you might also feel as if your joints are locked or feels like gelled and is very difficult to move. In your hand in particular, you might be having difficulty closing your hand. Difficulty closing your fist is an early sign of arthritis in your hand joints. And in general, the stiffness of rheumatoid arthritis typically lasts for 30 minutes to 60 minutes in a regular day. And symptoms typically improve as you move. That's why when you sit down for a long period of time, you might get a lot of symptoms of stiffness, but as you become active, the stiffness starts slowly getting better. Now, the third important symptom of rheumatoid arthritis is unexplained fatigue and malaise. As all of you know, RA is a systemic disease that it affects your entire body. and the entire body is inflamed, that could cause you to have severe fatigue and malaise. Overwhelming tiredness that does not improve with sleep could be an early sign. Some of our rheumatoid arthritis warriors also feel low-grade fever, and sudden loss of appetite could be an early sign of systemic inflammation due to rheumatoid arthritis. Some of you might also feel like flu-like symptoms, which is more of a generalized aches and pain in your body. If you have any of these unexplained fatigue or malaise symptoms, check with your doctor if in case it could be early sign of rheumatoid arthritis. All of you rheumatoid arthritis warrior, thank you so much for watching our video. Please like and subscribe to our channel so that you can learn more about rheumatoid arthritis. Our goal in our channel is simple. We want to make science simple for you. We want to make RA disease that you can understand better so that you can diagnose early and treat early. And we know early treatment preserve your joint function. So always understand better about your joint symptoms so that we can treat RA early. Please also accept our gift, the Holistic Rheumatoid Arthritis Guidebook in the PDF form, as well as a recipe of the smoothie that you can prepare early morning to fight against rheumatoid arthritis. Now, the number 4 symptom of rheumatoid arthritis is symmetrical joint involvement. And I call this a mirror image pattern, where the same joints in the both sides of your body are affected. This is a hallmark sign of rheumatoid arthritis that help us differentiate between other forms of arthritis. And commonly affected joint include your knuckle joint, the finger joint, and then the wrist joint. So this symmetric involvement is a key diagnostic feature of rheumatoid arthritis. Now, I have a bonus clinical symptom of rheumatoid arthritis, and that is bilateral carpal tunnel syndrome. Some of our patients, they could get carpal tunnel in the both of the hand, which could be an early sign of rheumatoid arthritis. If you have bilateral carpal tunnel, that is due to the compression of the median nerve, let your primary doctor know to run some test of rheumatoid arthritis, because it could be a hiding sign of inflammation in your wrist joints. And the carpal tunnel make you feel weak in your hand. You are not able to bend your fingers. You might feel numbness and tingling in your fingers. And you could also get some wrist pain, which could be a sign of carpal tunnel. But if the carpal tunnel is on both hands, it could mean rheumatoid arthritis. Now, the number 5 symptom of rheumatoid arthritis is warmth and tenderness in your joints. As many of you could recall, rheumatoid arthritis is an inflammation, and one of the most important features of inflammation is warmth around your joint, and that is due to increased blood flow into those joints, and the skin underlying those joints could feel warm. And warmth over a joint is a direct marker of inflammation happening inside your joint. And when you feel lightly into your joint, it might also feel painful or tender to touch, which is another key hallmark feature of inflammation. If you have severe rheumatoid arthritis, then you can also see some redness over the joint. So the redness is a marker of inflammation too. So the 5th important symptom that we talk is warmth and tenderness over the joint. If you have any of those, it could mean rheumatoid arthritis. Now, let me quickly summarize what we talked today. We talk about 5 early signs and symptoms of rheumatoid arthritis. And why this is important? Because of the fact that early diagnosis is the key in protecting your joints and staying active. If you have any of those 5 symptoms and signs, always see a rheumatologist who can help you make the diagnosis early. After the early diagnosis, your doctor might start treatment, such as disease-modifying anti-rheumatic drug or biologics if your symptoms are not doing better with the DMARD. And your doctor will also help you understand the lifestyle changes that you can incorporate to manage your rheumatoid arthritis better. So don't wait if you have any of those 5 symptoms of rheumatoid arthritis. If we treat early, then we can significantly improve your quality of life despite the diagnosis of rheumatoid arthritis. And long-term, you will do better if we treat your RA early. So take action today. If you have any of those 5 symptoms that I talked today, talk with your primary doctor and then get a referral to your rheumatologist. And thank you all of you rheumatoid arthritis warrior for watching our video. If you like this video, please like and subscribe to our channel, where we'll be providing you more information about rheumatoid arthritis. And our goal in this channel is to make science simple. Make the content of rheumatoid arthritis simple so that you can understand and apply those principles in your life. And I'll see you in the next video. Bye-bye.